So I see patients mostly who have problems with their lungs and with their esophagus, but I deal with all sorts of problems that are within the chest cavity. The most common patients I deal with are patients with lung cancer and esophageal cancer. I also deal with patients who have problems with heartburn and difficulty swallowing. Patients typically find their way to me after being referred by either a pulmonologist or a gastroenterologist who has noted that they have some of these particular symptoms or problems. But patients can also come to see me directly with specific complaints that might be related to problems in their chest. The first thing that I always do is send a letter not only to the referring physician but to all of the patient's other physicians. There are many doctors that patients may be seeing which have a need to know what's going on in my clinic and in my particular patient relationships. The other thing I do is I call the referring physician and make sure that there's nothing that was missed in the referral, that I make sure I'm answering exactly the question the referring physician had, and that way I'm able to personally communicate my findings to them. One of the biggest advantages of patients being seen in an academic medical center with an affiliated cancer center is the multidisciplinary approach. Nowhere else besides cancer care is the importance of a multidisciplinary approach more pronounced. Patients who have cancer will very often require treatment from multiple different specialties, not just of doctors, but of other types of providers like nutritionists and smoking cessation experts. All these people are immediately available, and a patient coming into the clinic is often able to see those physicians, or at least to have me talk to those physicians and other practitioners while that patient's still in the room. And so when a patient leaves my office, they're much more likely to have a complete plan as to where they're going next. And I think that alleviates a lot of anxiety and is a lot more efficient way to provide care. The most important thing I would like a prospective patient and a referring physician to know about me is that I am going to take the time that it takes to make sure that we understand clearly what a patient's symptoms and disease process is like and what treatments they're likely to benefit from. I don't worry about the clock when a patient comes into my office. When you're in my office with me, that time is yours, and we will stay there until all of your questions are answered and you feel comfortable that you understand clearly where we're heading.